Bottom line is, as we move forward, to be sober about the reality that, again, we are still in the first wave of this pandemic. To again remind ourselves the power and potency of our individual decision-making, our ability to bend this curve, ultimately to bend it down until we have a vaccine, until we are in a position to turn the page on COVID-19. It's your individual decision-making that will determine our fate and future, our capacity to mitigate the trend lines that you've seen that we presented here today, to mitigate the likelihood and need that we ever have to toggle back on these stay-at-home orders and revert back to where we were just a few months ago. We don't intend to do that. We don't want to do that. But I want to make this clear. We are prepared to do that if we must. Clearly, we have the capacity, individual and collective capacity, not to have to go in that direction by just being a little bit more thoughtful about how we go about our day-to-day lives. Read up on these guidelines. When you go to a restaurant and it's clear that they're not practicing what we are preaching, report that. Give us the tools to enforce. And I want to make this point clear because invariably it's asked of me on a daily basis and likely to be asked in a moment when I turn this over to questions. What is the enforcement mechanism? Foundationally, we look to local government to drive the enforcement. We more importantly look to the moral persuasion each and every one of us have as individuals to, again, be good examples so that when we're out and about and we're wearing a face covering, we're not only protecting ourselves and protecting our loved ones in the broader community, but we're also sending a message to people that they should consider doing the same. Our goal is not to be punitive. Our goal is to educate. Again, we're just a few days into this mandatory face mask guidelines. That's why I put at the front of this conversation that video. Again, deep gratitude to the former governors for being willing to participate in that video to highlight the importance of wearing face coverings. The next slide that I put up, about the 26 feet when you sneeze, that droplets can travel, I just hope underscores the seriousness to which we place this face covering mandate and the encouragement to have you and others participate in doing the same. But beyond that, the state of California and local government has the ability from a regulatory perspective to go after people that are simply thumbing their nose and abusing the privilege of this moment and not putting your best interest, your health interest at heart, or even their workers. The state of California has that ability, just as an example, and we're using the restaurants to the alcohol beverage control. I was on a conversation call today with many governors across the country. In fact, it was an all-governors call with the Vice President of the United States, comparing and contrasting best practices. There wasn't one governor that spoke that didn't speak up about the importance of enforcement and the relationship they have in terms of not trying to be punitive, not trying to be too aggressive or heavy-handed, but at the same time, being able to utilize tools in the toolkit. Again, focusing first on the cities and counties and the regions doing the same, the state from a regulatory perspective, not least of which ABC, but also OSHA, and the capacity, again, to educate workers, importance and, or rather employers, on the importance of protecting their workers and advancing the principles of the guidelines. Again, guidelines say how to reopen safely, and it's incumbent upon those within industry sectors that helped us, many cases, leaders in those sectors helped us draft those guidelines to procure strategies to manifest those guidelines to keep you healthy, to keep you safe as we transition out of this first wave and prepare for the fall and the likelihood of a second wave. I want to just close by making two additional points that were highlighted by Dr. Galley and can't be reinforced enough. You saw that one slide that showed 130.1 million masks that have been distributed throughout these sectors of our economy, the transit sector, our education system, obviously within the health and human service sector, the agricultural sector. We also, because of the magnitude of our capacity now as a purchaser. We currently have an inventory of 199 million masks. We've distributed 130 million. We have an inventory of 199 million. We're trying to turn that around as quickly as possible and get through all of those orders of masks within sectors and throughout the state, counties, cities, healthcare systems, and the like. By the way, that includes the precious N95 masks. We've received over 11 million of the N95 masks. Tens of millions more will come in over the course of the next few days and over the course of the next few weeks. As soon as we get those in, we want to get those out as well, particularly to our most vulnerable workers. Again, the heroes of this pandemic, our nurses, our doctors, the people that continue to be on the front line in the ICU, in the hospitals settings, and the like. And so I just want folks to know that we're very, very proud of the magnitude and the scale of our procurement and our capacity to help support the many sectors within the state of California. And accordingly, and you saw on that slide on the 130 million that we've already distributed, we've also been able to help because of the partnership we formed with FEMA, which has been exceptional. We've also been able to help some other states with their needs as well. So it's a point of pride and a point of privilege that we say this, but again, point of protection for each and every one of us to wear these face coverings and to make sure that we mitigate the spread, again, through this, what we call non-pharmaceutical intervention. There are two non-pharmaceutical interventions that we know that work. That's staying at home, practicing the kind of physical distancing that a stay-at-home order provides, and then wearing face coverings to mitigate those that cannot practice the physical distancing and social distancing when you are in cohorts where you're mixing with people that otherwise you had not mixed with in some period of time. So testing going up, 92,000 tests, a record in the state. Not surprisingly, over the weekend, a record number of people that have tested positive. A positivity rate that is holding but is slightly now increasing. Hospitalizations that are increasing, but within a capacity that our system can handle. ICUs growing accordingly, again, within the framework of capacity our system can handle. More and more masks being procured, more and more masks being distributed, and more, dare I say it, responsibility on each and every one of us to practice the physical distancing and be thoughtful as we move back in and begin to mix into the economy with all of these meaningful modifications that we've seen in at least 54 counties in the state on the stay-at-home order. Final comment, because it's a point of pride, I want to just thank those that have participated in this Great Plates effort. I mentioned a few months ago, and it was just a few months ago, that California was going to become the first in the nation to provide meals for our seniors. Dr. Galley reinforced the need for me to reinforce this program by saying for those that are 65 and over, people that have comorbidities, morbid issues with their immune system, issues that relate to pre-existing conditions, with age, how sensitive we are to your needs and our larger community needs within that cohort. If we're going to ask folks to stay at home, we've got to address the issue of social isolation, the issues that obviously manifest people that aren't feeling connected to loved ones, and others that feel isolated, are indeed isolated, but also vulnerable. And that's why the Great Plates program is so important. It was conceived to solve multiple number of problems. One, to address the nutrition needs. Great Plates is indeed about providing meals to our seniors that are isolated, but it's also to provide a sense of continuity of care. We announced on Friday that over 1.6 million meals now have been delivered just since the creation of this First in the Nation program, and how over 5,800 jobs have been supported, not only within the restaurant industry, but helping support those that are delivering these meals. But one of the things that was so humbling and so extraordinary, and it's the reason I'm bringing this up, are the number of letters that we've received, cities, counties have received, mayors have received, that they forward to us, that we realize it's not just about delivering nutritious meals. It's about that knock on the door, the only knock that a senior may receive on any given day. It's about that phone call saying, how was the food? And was it to your liking? Is there anything more I can do from the restaurateur checking in on the senior to make sure that they're providing quality? And the fact that someone reached out, made a phone call, the fact that someone knocked on the door, that someone that meal has been as impactful in some cases, based upon the letters we've received, as the meals themselves. Ability, again, to connect to people that feel totally disconnected and isolated, fearful, fragile, literally and figuratively at this moment. And so I just want to encourage all of you, not just through a program like that that's been so successful, over 30,000 seniors getting the benefit of this program. Again, not every senior gets the benefit of the program. It's an income eligible program. It's people that otherwise are not eligible for other programs that get the benefit. But the fact that we're doing it is just testament to individuals that are discovering something even more extraordinary, and that is the power and potency of their voice and their willingness to connect on a human level with another person. And that's why I just want to encourage you, even if you're not part of the Great Plates program, become part of something bigger than yourself. That COVID19.ca.gov website also has volunteering information, has information on how you can support seniors and how you can just make calls and check in on strangers, see how they're doing, make a difference in people's lives. I always say the happiest people in the world are volunteers. So if you're feeling a little down, you're feeling a little blue, you're feeling, again, fearful, anxious, again, a little fragile, one of the most significant ways you can change your own outlook on life is by reaching out to someone else and checking in on their life. And again, I can't be more encouraging than your capacity to make a difference in other people's lives, and in turn make a difference in your own life by checking out those volunteering opportunities. COVID19.ca.gov, wonderful resource for that as well. With that, happy to answer any questions.
Jackie Botts, Cal Matters.
Hi, thank you, Governor, for answering our questions. My question is about the safety net programs that you've stood up during the pandemic. That includes pandemic unemployment assistance, the Easy Place to Apply, pandemic EBT, Great Place Delivered, which is described, disaster relief assistance for immigrants, Project Room Key. Many of these programs are first in the nation, but reporters have also documented bumps along the ways, delays, clogged phone lines, et cetera. I'm wondering if you could, for me, if you were writing your own report card, what grade would you give yourself for these safety net programs in terms of how well they've delivered on the promises that you made when announcing?
Yeah, I'm very proud of starting things from scratch. I'll leave to more objective minds. People come with their people come with a subjectivity oftentimes, and I come with an open heart and a humbleness that when you start something from scratch, you take pen to paper, you take an idea, and you're dealing with a lot of challenges in the state. We just were able to get together, legislature over the weekend, get a budget deal together. Now, a lot of news, getting PG&E out of bankruptcy, trying to deal with the issue of racial injustice and police reform, systemic issues that we have to address as a nation, dealing with, we had 429, or I think it was 400, it was about 429 wildfires we were monitoring last week. We are doing our best under very challenging circumstances. The fact that we have over I think it's 14,000 human beings we estimate in the 11,000 or so rooms off the streets and out of congregate facilities and shelters under Project Room Key. I couldn't be more proud of that. We could have just walked away and never even endeavored to do something audacious, do something no one else had ever done, do something no one else is doing. We did it, and I'm proud of it, proud of the work that we've done on this Great Plates idea. We could have just walked away from it, never even endeavored to do something that helped support 5,800 folks that's made a difference in the lives of tens of thousands of our seniors, million plus, 1.6 million plus meals served. To the extent that we were able to procure an unprecedented amount of masks, not only for our state, but now helping other states, is testament to a commitment and tenacity not to allow critics to get in the way of progress and to put our head down and try to solve problems. I'm proud of the progress we've made in that place as well. We've distributed over, $34.3 billion just since March 15th. $34.3 billion. This was March 15th, not of last year, this year, in unemployment and pandemic unemployment assistance. That's not something the state has ever had to do in the past, and I'm proud of the work that they've done under very difficult circumstances. We haven't been shy about being honest about the frustrations we've all shared and the thousands of people that we had to get redeployed to help support those phone lines, and dealing with the magnitude of call volume, 5.7 million people now that have applied for unemployment insurance, a PUA insurance, just since March 12th, not 15th. And so, all these areas are opportunities to do more and do better, but I'm very proud of the team for being able to meet the moment overwhelmingly and to advance some best practices for the rest of the nation and not be timid and not be shy about the work that we have in front of us.
Hi, Governor. So you talked about the positive case rate increasing and hospitalizations going up. So how seriously are you, or how worried are you about the new infections and hospitalizations? And is it safe to continue reopening, given that a lot of people are still choosing not to wear masks? And finally, are you worried that Californians have started to normalize the deaths and illness from coronavirus?
Yeah, we had 20 lives lost yesterday to the virus. I should have began with that. Thank you for the opportunity to remind people. People are still losing their lives to this pandemic. Our hearts go out to every one of the families and individuals, obviously, but family members who've been torn asunder because of this pandemic. The hospitalization numbers are something we've always been focused on, the positivity rate and the total number of positives, particularly as our testing has substantially increased and we have a greater sense of understanding of the community spread than we certainly did 3 weeks ago, 3 months ago. We've been putting together not just a plan for a hospital surge. That slide I showed you a moment ago, the 52,000 beds, that's just in the hospital system. We have, in addition to that, these alternative care sites. I've mentioned on multiple occasions, I'll take this opportunity to mention it again. I get every morning the list of the 10 counties that have the alternative care sites and what's the current inventory on those sites. This morning it was 19 individuals in a system just on the alternative care sites that we can turn on at a moment's notice of over 1,500. So there's great capacity, not just modest capacity there. I referenced the 7% or so capacity within the hospital system. So that's 93% capacity still available, 7% that's being utilized. ICUs have always been consistently in higher numbers in the 20-30% range. And those are, as I said, holding strong, 28% last week, 29%. So look, we've been concerned from day one about the spread of this virus. We've taken it very seriously. We're the first state in the nation to do a stay-at-home order. But at a certain point, when you have 5.7 million people that have filed unemployment insurance, a certain point when people can't get preventative care, a certain point when unemployment rates are the highest they've been since the Great Depression, a certain point you have to realize and rationalize that the issues of the social determinants of health, the issues of poverty, the issues related to hunger also cause disease and have a profound health impact. And so one has to be mindful of that as well. And that's why we've worked hard to safely reopen the economy. It's why we've given the tools to the locals to make the decisions for themselves. That's not the case in every state. There's been mandates from atop, including even on face mask coverings, where they're denying local government in many states the ability to make that determination for themselves. And we've tried to create some flexibility in a state as large as ours. And so we've always walked into this with our eyes wide open. We've always prepared for a surge. We have surge capacity identified. We've shared that with you today in multiple days. The reason we are procuring hundreds of millions of masks is in anticipation of being even more prepared, replenish the shelves, so to speak, but also prepare not only to get through this first wave, but to prepare for a possibility of a second wave. We continue to have more work to do in terms of making sure that we are safely monitoring with the kind of technical assistance that is appropriate at this time, the reopening of economies and sectors, and also trying to do our best to enforce through social persuasion or more aggressively working with cities and counties to enforce those that are flouting the rules and the laws and putting people at risk. So we're in that band where I feel like we anticipated the likelihood as we reopened of these numbers increasing, and they have. And I'm confident, of course, the next few weeks and months that we have run scenarios and have procured strategies and will be able to implement strategies to do a lot more if need be.
Jeremy White, Politico.
Governor, thanks so much for giving us a moment. Sort of going off of Kathleen's question, you talked today again about the need to be able to toggle back as necessary. And I think a question a lot of folks have is, are there specific fixed numbers or metrics you are looking at that would trigger now is the time that we need to reimpose some restrictions?
Well, we're working with, the point of the emphasis, Dr. Galley, and the recognition that we have a county lens on this is to make this point. Everything that I presented to you is in the aggregate, and I've said this often, I'll repeat it. We don't live in the aggregate. California is 58 counties, 470 plus cities, different lived realities. And so the answer to your question is, from my perspective, a nuanced response, meaning at the county level, within industries and segments within the counties, we need to be prepared to do that. Doesn't mean that we are doing that. I thought it quite interesting, illustrious example, that Lassen County, you recall a few weeks ago, they had moved forward into a new phase. Health director decided to pull back a little bit, only to move forward again when certain criteria and conditions were more confidently met. That's exactly the kind of protocol and kind of responsiveness that we're looking for from health officials and health directors and local elected officials. We put a lot of responsibility into those their hands, and accordingly we want to provide technical assistance to support them through navigating the application implementation of the rules of the road that they're putting out in terms of timelines for reopening. So the technical assistance is foundational. We're now monitoring technically, again, 11 counties. It was 13 last week. And if we see persistent challenges, if we see things that raise red flag concerns, and Carroll County has been an example of that, in terms of trying to need to decompress their hospital system and some of the cross-border issues, then we will hold the line a little bit more. And to the extent we have to, we can pull back.
Katie Orr, KQED.
Hi, Governor. You mentioned earlier that you've come to a budget deal with the legislature, which was announced today. Can you give us any more details about what that agreement contained? And specifically, have you guys decided to go with your method of trigger cuts or the legislature's, which would wait a couple more months to make them?
Yeah, we made compromises across the spectrum. We'll be putting out much more specific details in the coming hours and days, and certainly through the week. I just want to compliment the legislative leadership, the Speaker and the Pro Tem, budget chairs in the respective houses, to advocacy community that was incredibly responsible in terms of their advocacy and also pointed in terms of their concerns about prospective cuts. I want to thank city and county leaders in particular for their guidance, their counsel, their input in this process. The work we did on issues that remain stubborn issues in the state, on homelessness and housing. Again, work we have to do together over the course of the next few years. This is a multi-year framework. We're not solving for everything in one calendar month. We have a lot of work to do over the next few years, and we cannot impress upon the federal government more the important work they have to do to help support municipalities, large and small, states, large and small, to help support us through this unprecedented period of time. And the magnitude of this pandemic has placed in terms of pressure on our budgets. Remember, it's not just having revenue shortfalls. It's also addressing increases in caseloads at the same time related to the economic consequences and the displacement associated with COVID-19. Cannot again, though, be more appreciative of all of the leaders and the cooperative spirit that brought us to an agreement simply hours and hours ago, in the evenings, late last night. And as the dust settles on all of that, you can pick apart the areas where we found common ground. This is not about disagreements. A budget deal is about where we found agreement, and I want to thank them for doing just that.
Mike Larry, KCRA.
Yes, Governor, just diving a little bit more into the details of that, if you could share any more details regarding the deal in terms of what was agreed to with the legislative leaders, specifically for University of California, California State University, and the tax breaks that were going to go to small businesses.
Well, there are tax breaks that we will benefit small businesses. We had an eye on focusing on the need of small businesses, not only for those that want to start their business and providing some tax relief for those startups, but also recognizing that not every small business is a beneficiary of some of these federal programs, be it programs for support from the SBA or programs through the PPP program. Many have fallen through the cracks, and as a consequence, we have provided more resources, more loan capacity in that space, in addition to what we did through the process under the executive authority provided under emergency capacity. The legislature afforded me a number of months ago in the creation under this iBank of loans along these lines. We've done a number of other things to help mitigate education cuts that were part of the May revise. We have also deeply focused on a lens of equity. That was a foundational principle thrust to which I made very abundantly clear on multiple occasions, and I know is deeply part of the zeitgeist and value proposition of the California legislature, and we came to agreement in that space. You'll get all these details that'll be brought out in the next hours, as I said just a moment ago, days, and certainly over the course of the next week.
Dustin Gardner, SF Chronicle.
Thank you, Governor. With respect to the budget deal and deferring some of the cuts to schools, I'm wondering, are you confident that this will address the concerns that districts have about their ability to reopen if they don't have full funding?
Yeah, I think the funding substantially exists. It's not an increase as much as I had hoped when I put out my January budget. As you recall, my January budget, we talked about historic investments in special education, historic investments in preschool, historic investments in teacher retention, teacher training. We talked about a deep desire for more residency programs, more mentorship programs. We wanted to recruit more teachers that look like the student body, diversify our workforce. All of those enhancements, unfortunately, we are not in a position this year because of a $54 billion shortfall. Again, I was in a different mindset a number of months ago. We were projecting $6 billion surplus, which candidly was closer to $10 billion. We unfortunately not in that position, but we were able to, working with the legislature, working through deferrals, and working to get a lot of the federal CARES Act dollars into our education system. Those dollars could have gone anywhere. We put a substantial amount into our K through 14 education system. We think a lot of that anxiety is mitigated. And I just want to make this clear. It's an important point as more details will be forthcoming, that we have provision layoffs. That is good news. That was foundational, important, something we all care deeply about, and something we are very proud. I don't want to speak for legislative leaders, but I'm sure they were very proud that we were able to all accommodate our collective needs and be able to make that commitment firmly.
Sophia Balog, SACB.
Hi, Governor. I want to turn for a moment back to the mask order. There's been a lot of confusion from members of the public about how it will apply to various sectors, from everything from schools to gyms and other types of businesses. So you said earlier you want people to report to their counties if they see businesses violating the rules. Can you clarify exactly how this is supposed to apply to sectors where you've already released other guidance that doesn't necessarily mandate mask requirements?
Yeah, good news, all those guidelines are being updated with the new mandate, and that should very quickly answer the question.
Hi, Governor. A couple of things. First of all, there seems to be some mixed messaging. This is what I hear from people just out on the street, where on the one hand, they hear that we're having a record number of cases, record number of hospitalizations, wear masks, wear masks, wear masks. On the other hand, they see more and more things reopening, and they are told, get a haircut, go to a restaurant. And some even notice it on the state website, unlike the shelter-in-place order, which was a legal public health order. It just says guidance, and they take that to mean it's not mandatory, even though it includes words like mandate and must. Can you address the mixed messaging that still seems pervasive out there, where a lot of people say this can't be as bad as they say because, look, they're letting everything reopen? And as you've been touting more testing, what is your reaction to President Trump having told his staff to scale back on testing, slow it down, which the White House has offered several explanations for, but it now appears he actually did?
I'm very proud. We had a record number of tests yesterday. We're now exceeding our goal of 60,000 tests. I'm proud of the work that our team has done in that space. We'll continue to be strong advocates for more testing, more community testing, and make sure those that want to avail themselves to testing, that they have the capacity to get the tests. And so I think there are a few states, I don't know many states, that are testing north of 70, 80,000, as we have been over the last number of days, of their citizens on a daily basis. And I hope we can continue to see those numbers go up, though we are getting close to capacity in other respects, and that is there is a big cost associated with testing. That's moreover my concern related to anything that came from this administration, is how they can support more testing at the state level and not put us in a position where we don't have the resources to continue to advance the testing at the kind of scale that you deserve and the public deserves. As it relates to the messaging, it's very clear. It's crystal clear. As we reopen the economy, communities large and small determining when to safely do that based on conditions within their communities. Again, California's a state that's as large as 21 states combined, population roughly equivalent to Illinois, New York, and New Jersey, just shy our population of those three states combined. We put a lot of onus on local health officers, local conditions, and that's where the guidance is foundational. We listen and we attest to their concerns. We put them on websites available on covid19.ca.gov, and we give people the capacity to toggle through these attestations and through the counties to see how their communities are doing. Dr. Galley, just a moment ago, highlighted 11 counties that we are working with on technical assistance that are a point of some concern that are examples of areas where the state and local government are working collaboratively together. We've made it crystal clear that as we reopen the economy, we're never going to be in a permanent state of shutdown. No one ever suggested that. Over months, we've been talking about phasing in a safe reopening of our economy. We've said that guidelines don't mean go. We said that when we put the guidelines out, we focus on how, but not when to do it. That when local health officials, through the attestation process, decide they're ready to do it safely. And through the guidelines, you'll see very detailed guidelines on what that means in terms of different sectors of our economy, different types of businesses, how social distancing can be advanced, how physical distancing can be advanced. And now we have put out what exists for many local governments, and that was guidelines on face masks that were encouraging a face mask. Now we have mandated face masks. There's no ambiguity there. It's a mandate for face coverings, and the order made it clear what that looks like and when it's appropriate to wear the face coverings. It was just asked, I thought, a very good question about the guidelines, these 38 sectoral guidelines being updated. We've been working feverishly over the weekend to update those guidelines to incorporate the new mandate on face coverings. So that'll be out very shortly. But this process has been very transparent, and I just hope folks recognize the magnitude of this moment, which is we're still in the first wave of this pandemic. We're not out of the first wave. We're seeing an increase in total number of positive cases. We're seeing an increase in hospitalizations. And all we ask is if you feel like this is too exhausting, you feel like you've just had enough, if you feel that way, that's understandable. But please, as you go about going back to some semblance of what life looked like in December, November of last year, do so safely and honorably by protecting yourself and your loved ones and wearing a face covering, we believe, outside of physical distancing is the most important thing you can do.
Final question, John Horn, ABC San Diego.
Governor, thanks for taking our questions. You mentioned earlier in your press conference that there were some anxieties that would be relieved when it came to education. You mentioned teachers, a provision against layoffs. I was wondering if you could give a few more details on what anxieties are being relieved by this budget.
Well, it's substantially addressing what potentially was a $19 billion cut within what we refer to in California, our Prop 98 funding requirement. That was the magnitude of the shortfall that impacted Proposition 98. I just want to remind folks, forgive me for belaboring this, just a few months ago, I announced a budget that projected roughly $6 billion surplus. In fact, about a month after I announced that budget, new revenue came in that was ahead of what we had even anticipated, showing how strong the California economy was. Record low unemployment, record reserves, record GDP growth, at least in modern terms. We averaged 3.8% GDP growth over a 5-year period that we hadn't seen in some time, at least in the state of California. And that all changed. $54.3 billion budget shortfall just a few months later. And the magnitude of that is fallen on all of us to address substantively based on constitutional provisions on state leadership. We have a legal obligation to balance our budgets. We can't do what the federal government can do, and that's kick the can, print money, and the like. And so we had to work feverishly to figure out a way to do that that mitigates the harm to those most in need, the most vulnerable, including our children and our teachers and the like. And so we were forced to address a $19 billion potential impact. We began to knock that down. I put out a proposal to the legislature and knocked that down. We went even further. We worked together across some technical differences in terms of how we distributed those funds, including the support from the federal government to target issues around learning loss and equity in our school system, which was so foundationally important to me, and I know legislative leaders. There was concern and anxiety about layoffs and pink slips, and that was substantially addressed with language that is part of this budget bill that I look forward to signing based upon the agreement from last night. So we made a lot of progress. By no stretch of the imagination is where we wanted to be, and the reason I'm being so long-winded is to contextualize where I hoped we would be when I announced the January budget versus where we are here in June, and comparatively. We wished we could do a lot more because our educational system is still substantially underfunded in the state of California versus other states, and we're going to have to be very resourceful in the future to find additional capacity to make more investment, not less, in our public education system. With that, let me just encourage people to take more seriously, not less seriously, where we are at this stage of this pandemic. We have a mandate for wearing face masks. There are exclusions based upon being a toddler, 1-2 years of age, people that have certain conditions where wearing a face covering is more problematic, not less. And I encourage you to take a look at the guidelines that came out from the health department. They're available on the covid19.ca.gov website, covid19.ca.gov website. To the extent people want more information about what the mandate does and doesn't do. I encourage you to continue to listen to your local health directors and health officials that are front lines of this pandemic. Continue to express appreciation, as we always should and must, to our frontline caregivers that are still on the front lines of COVID-19. And I'm just, again, grateful to them, as we all should be. We'll get through this, no question in my mind. We are a very resourced state, and we are in a much better position than we've ever been to tackle this pandemic. Mark my words, we'll get through it, and we are in a much better position across the spectrum than we have been in many, many months. But the numbers are increasing as we reopen the economy. And as we reopen, all I ask is that we are more vigilant than we have been, even perhaps than we were a few months ago, because we need to get out of this first wave and prepare for a second wave and get through this together and get those immunizations out. And we'll get back to a more resilient mindset and a more robust and abundant California into the new year. Take care, everybody. Thanks for the time.